Good morning, good afternoon, good evening. It depends on when you're listening. And welcome to The Solution. Nothing changes if we change nothing. We're the New York City Prevention Resource Center housed at Children's Aid, and we are funded by the Office of Addiction Services and Support. And that's NYS, New York State OASIS. Okay, that was a mouthful. Hey, Chevar.
Good to see you. Well, I saw you a few minutes ago via Zoom. We're back to Zoom again doing our podcast. Well, it's good to see you.
It's good to see you. But we've actually gotten to see each other recently twice in person.
Absolutely. We know each other, people. I don't want you to think this is the first time we've seen each other in person.
Right.
So, but I mean, after the whole pandemic, 2 years, we were able to go into the office and see one another. And big hugs, big embrace. It was great. I ended up having a haggling that day because this what's the season called? Allergy season, the best season of the year.
I know that's the one drawback of spring, my allergies too, but it just is so good to see you. I mean, I got to see you yesterday too, and
absolutely,
you know, it's weird because you know, we've been doing this for 2 years. We'll keep doing this virtually, but you know, we just had a virtual training that was pretty incredible.
Yeah, it was a motivational interview, which I love. I think I excel at, because it's all about.
You did.
It's all about having the person be a part of that conversation. Like you're not making the person feel uncomfortable, accused. Like you're not. It doesn't feel like you're accusing them of anything. It's like, let's talk about what's going on. Like, what are your thoughts on this?
Exactly.
How does it make you feel? How can you or we be successful in this? Like what are the next steps? I know for like people listening, what are they talking about? We had a training. I had someone I was partnering with, and I asked the person, would they be willing to invite their friends to be a part of a session? And that person lit up. I was like, wow, I would have never thought to invite my friends. Yes. And I was like, wow, good thing you said yes, because if you didn't, what would be next? But it just made that person felt that they were listened to, that they can, it was inviting, that it's not only about them, it's not only about them as the whole person, but also their entire life, by inviting their friends in to talk about what's going on. Although it was a fictional conversation, but I know via our feedback session, we talked about that, and they definitely share like that. I made them feel very welcome, and made the conversation about them, about what's going on with them, and not accusing them, not demanding them of doing things. How do we compromise? How do we be successful? How do we, what are the mediums? Look at what's going on, posing the questions to see what's going on within yourself. It's a facilitation trick, you don't teach them, you facilitate, you guide them into a direction.
Well, it's who you are and the way you talk to people, which is why you do so well as a podcast host, because you ask those questions. And I think, it's something that does come natural to you, and it really does show. But we just literally had a 3-hour training, and then we popped in here. So we're kind of really motivated right now, motivational interviewing, and the basics program, which is a brief intervention type of program for college students. And then we've got some guests. We're going to be talking about some other stuff. I mean, there's so much that's been going on, and the news feed is always filled with the things they want us to look at. But
yes,
I'm seeing between the lines the thing that's glaring in my face, that other pandemic or epidemic, whatever you want to call it, that's all the people who've died of overdose and continue to.
Yes.
I mean, I just can't believe how over 100,000 people overdosed last year. It's unfathomable to me. When I started out in this profession with overdose prevention, at least in 2000, and I have to think back, 2003, the numbers we were looking at that were making us feel like we're overwhelmed were far less than the ones we're seeing today. And it's really discouraging. It's really sad. And hopefully we're going to get some positive stuff out of our conversation today, and look at ways that people can, be prevented from overdosing. Programs like the ones we talked about today that we learned about are a key tool in all of this, helping people where they're at and bringing them the resources they need. So it's just so many thoughts going through my head. I look at the news feed out there, and I'm like, come on, we got to change what's out. We got to change it. We got to be talking about the things that really are going to affect every human being.
You know something, Ronnie? Last time we talked about normal, right? And unfortunately, like normal is fictional. It's a fictional idea. It's really fictional because what you just said is a norm that we're living, but we aren't addressing. That this many people have overdosed. That's unfortunately a norm that we aren't, addressing, that we aren't talking about. Like the norms that we normally talking about is the presidential election or fare hikes. I mean, that's cool, but what about the people?
Right. We hear numbers. We learn about the people. I just read an article actually in Newsday this past weekend. They showed the people. And we need to see it. We need to put faces to those numbers. Somebody's mother, somebody's father, somebody's brother, sister, aunt, uncle, friend, name it. That's who's overdosing. It's not just some distant number. And sometimes we lose track of that.
No, absolutely. Numbers, I know we use numbers to prove a point, but the other point is that person is gone.
Right. It depersonalizes things.
Yeah.
And people have gotten so sensitized that it's like they're excited when it's less than 100,000. It was only 90,000. We've just lost the ability to really look at things.
Yeah, that number thing, you brought up a good point. Well, it was less than, but people still died.
Right.
It's like that. So those people less than 100,000, they aren't valued. That number,
exactly.
One person, even if it's one person, that's still important. How do we support? And so we have zero or negative 1,000. I know that's not a number, but how do we?
I'll take it though.
How do we grow from that? Like, what we should look at that. I think, again, I have this saying, like, it doesn't affect you until it affects you. And that's when people start, oh my God, when that number's so low. Well, it wasn't my family member, it wasn't my friend, but it could have been your friend. It could have been your family member. It could have been you.
Mm-hmm.
And you told us an interesting story earlier this morning to us about someone you met on the train, mm-hmm. and how the conversation, you helped change that person's initial outlook. Wait a minute. So. Well, it seemed, based on what you said, it seemed. Yeah, I'm sorry, go ahead.
Yeah, no, I hope so. I mean, just to put it in context for people listening, I was sitting on the train yesterday and a very large man sitting somewhat next to me fell over. He must have fallen asleep or got weak, and he literally fell on top of me. And I jumped, and he got really defensive and freaked out and was ready to give me an argument. And I just kept assuring him that I was glad I was the person who was there to catch him, and that no matter what, if he's in my presence, I'm going to catch him. And you're right, it did transform it. But I didn't mean to interrupt you, so please continue saying what you're saying.
No. Thank you for clarifying. Like you changed that person. I'm pretty sure you lightened that person's day up. Because sometimes just saying hello to a person can change a person's outlook. Mm-hmm. Asking them how they're doing. You saying like, I caught you. Like, you fell, but I caught you. Wait a minute. You have to think about it. Wait a minute. You're right. You did catch me. You could have pushed me over. You could have let me fall. You could have yelled at me. There's so many things you could have done negatively towards this individual, but you took a different approach. I caught you. And sometimes people need to be caught.
There were people on the train who literally jumped away when he fell, and he wasn't anywhere near them, and they didn't come back, and they were staring at us. And I thought, what does it take to be kind to another human being? To be able to just smile and say, hey, it's okay. You're human. I mean, we wound up talking the whole ride after that. I had to tell him when his stop came because he would have missed it because we were talking. And then he cleaned up the seat around him. He got really interested in that. And I said, get off the train. You're going to miss your stop. But that's my new friend. Hopefully I'll see him again.
And you literally changed his day. Trust me. You said, you probably didn't think about the cleanliness of the train. It's always dirty. Like, wait a minute. Someone caught me. I need to catch the next person by cleaning up behind myself. So when someone sits here, they have a nice spot to sit next to you, right? Like he wanted someone to feel comfortable that when they sit next to you, they have a safe space and you will catch them also. So you were that person's angel. You caught that person.
Yeah, and thank you for putting it that way. And he was my angel because he puts life into perspective. I find that, I get all these earthbound angels who cross my path, and I see that there's there's a place for me in this world. There's a place for all of us. And I see that, there are people out there who are having a tough time. And no matter what's going on in my life, there's going to be somebody who's having a tougher time. And I'm not having such a tough time, please, but you have those days where you wonder, but I'll think of him on those days. Like, okay, I could be there for Dennis, who was 57 and a paralegal, college grad, homeless right now, looking for a job.
And that's the thing, like you just identified the person. You gave that individual a name. That person has a name. That person has a story. That person graduated college. That person is a paralegal, but that person fell on hard times. And it doesn't take away the fact that Dennis is still a person, that Dennis is still human.
Yes. And I because I travel the trains and stuff, I'm in certain groups like on Facebook about, traveling. And I'll not hear, in my head, I'm so used to reading it, it's like I hear it. People make such derogatory posts about people at Penn Station and the homeless. And I get offended. And no, it's not pleasant a lot of times, but something I have to do in my life is look and say, why is that person there? Why are they acting like that? What got them to this place? Yeah, we see things that are really reprehensible sometimes, but what got that person there? Everybody starts out the same way pretty much as a little baby. Is that what they thought would happen in their life later on? No, probably not.
Yeah, you bring up a good point. Like that's not what the universe, we don't know what the universe has for us, but the universe does give us life. The universe, sometimes you're able to make it, sometimes you're able to control your choices. Sometimes you can't. Like initially he was able to control his choices to become a paralegal and finish higher education. But he couldn't control the fact that he no longer probably doesn't have that job anymore and probably doesn't have a place to live.
Yeah, that's pretty much what he said. Well, as is always the case, our doorbell is ringing. So should we let our guests in?
Absolutely.
Okay, I'm going to let them in and we'll let you tell them a little bit about who they are. Okay.
Yeah, this is that awkward silence.
I know, it's radio silence. Good afternoon. I almost say good morning. Okay, we got to work on your sound there a little bit.
Hi. I think this might be a little bit better. Can you hear me? Hi, how are y'all doing today? So good to see you too.
Good to see you. And we have another guest arriving. So we're just going to.
My coworker is joining.
Okay, welcome. Good afternoon. Glad you're here with us.
Yes, I'm glad to be here. Thank you for having me.
Okay, well, how about if each of you introduces yourselves and tells us who you are and what you do?
Absolutely. I think I can go ahead and start. So my name is Yamir. I use they, them pronouns, and I'm a program manager at the NYU Silver School for Social Work, specifically the New York City Communities for Health, NYCC4H. We were previously known as the Bronx Family Coalition for Health, though we have recently expanded our name to include a couple of other catchment areas and increase alignment with our new focus areas. But before really jumping into that, I'd love to let my coworker Javier introduce himself. And just very briefly, we're going to be doing a muting tag because we're in the same room, so we don't want our audios to cross over.
Hi, so it's very nice to see you. My name is Javier Martinez. I am one of the program coordinators here at New York City Communities for Health. Sorry, I'm one of the program coordinators here at New York City Communities for Health. And yeah, what I do is I mostly coordinate the implementation and outreach of our programs. So I work in, making sure that we are engaging the community and also in doing the actual service delivery of everything that we offer.
Thank you both for introducing yourselves. And we definitely get the whole thing with the muting. And we were in the office together yesterday and had to wear noise canceling headphones when we were at the same meeting because we were driving each other crazy. But we want to talk to you about your work, today. And I know the last 2 years have been crazy, but there are also people who have been out there on the ground, and your work continued no matter what. I mean, a lot of us got to work from home, but the people who are out there doing the direct service, it was a different type of world for you. And what's it been like for you the last couple of years?
Yeah, thank you for that question. So you're completely correct in that the last 2 years have been absolutely wild. It's been a very challenging process. That's also been, I think, a very fruitful process in us really, being able to analyze where our deficiencies are and where we can grow and improve. So for both two of our largest programs or projects, the Saber Haven project, as well as the ETN project, which stands for Educate, Test, and Navigate. The first project was funded about half a year before the start of the pandemic. And the ETN project was funded in the middle of the pandemic, approximately, I believe, 8-ish months after it was declared as a global pandemic. So it's been a very interesting planning process, specifically with Saber Haven. Really in the middle of the planning, understanding how are we going to keep reaching people, with prevention and substance use disorders and overdoses. We know that the global pandemic didn't mean that people stopped using drugs. On the contrary, we really saw a rise in substance use as people were dealing with the pandemic as they could, and the various stressors associated with it. I think the various inequalities that were really that came to the fore during the pandemic. So with our planning, we really tried to implement a hybrid approach. So we were trying to, of course, respect NYU, New York City, and New York State regulations. So for a certain point in time, we weren't able to do in-person work. However, we shifted to online work and online outreach, trying to reach people through our social media accounts, through calling. But as soon as we were able to come back and do in-person work, we immediately shifted to do so. We really see the importance of meeting people where they're at, and especially with a program like this, we see such great outcomes and such great benefits from interacting with people face to face. We really benefit being able to communicate with people directly, and I think that's the way that we can really build trust and build relationships. It's a little bit more difficult over the phone or over the webcam. I think at the same time, in delivering also remote services, we've been able to reach so many more people. We see that there's also such a large benefit in that, people have really busy schedules. With the parents that we reach, they can't, stop what they're doing and meet us, at our office. So by delivering a phone and Zoom meetings, we're really able to reach them wherever they're at.
Yeah, I mean, I totally get what you're saying. It's on one hand, it made things a lot tougher, but on the other hand, more people are able to be engaged. So there's there's different variables of it. I like to look at it overall and think that we've really kind of just really improved everything. It gave us a lot to work with, and we've been so impressed with everything we've seen, how creative people have gotten, because we have been kind of pushed into a very uncomfortable place to be able to be creative. And I'm hoping these processes don't end now. Let's keep up the creativity. So.
I could not agree more. I think that, with these global challenges, it's really forced us to be creative and innovative. And I think that's just the spirit of, the services that we offer, and, the long legacy of the people that came before us, whether they're in prevention or harm reduction. They've always had to be creative in the face of, the challenges that they saw, whether, with how these pandemics have impacted people around them, or in how different policies have not aligned to really support them. They were forced to be creative. And I think similarly, the pandemic is forcing us to be creative and innovative in order to, really have the largest impact that we can.
Can you give it? Well, I just want to say that you mentioned, Yamir, about about drug use and how things have increased literally right before you came on, Ronni and I were having the same discussion, and how overdose has been on the rise. and something that we wouldn't have realized if not for the pandemic. That's something I always talk about. When this pandemic is over, I need to see the numbers. The numbers are going to be something we've never seen before. But because you mentioned also, or Javier, about the creativity, like, can you talk about that? What does that look like? Is the conversation different? What's the engagement like? Like, how are you doing that, doing this through this new realm of the screen realm? Like, this sounds so weird. Talk about that.
Yeah, I would love to. I think exactly like you said. I think we really need to see the numbers when the pandemic is over. And I think, unfortunately, with a lot of the surveillance data that we do see, that is really a reflection of not the current state, but of like the past year or even like previous to that. So we're not really seeing how many people are overdosing live. We're not really going to know the impact of overdoses and the impact of fentanyl from March 2022 until a couple of months, if not years, especially with that clarity. And I'm thinking, with fentanyl really being the driver of overdoses, we're really focusing on how can we reduce harm. And as I was trying to say earlier, we stand on the efforts of giants and so many people that have been on the forefront of this work for decades, really taking care of their community. And I think that's really something that's at the center of the work that we try to emulate. And that a lot of the efforts led by these people was, caring for their own community members and really helping them survive. And there's been, I think, a large change in the national discourse in terms of like what harm reduction is, especially, the large argument that it only enables people. But, that's not how we see it. And I don't think that's really what the evidence points to. We see harm reduction in the form of naloxone or overdose prevention centers or fentanyl test strips as saving lives, like very simply put, and in the ways that we really humanize the service delivery as well as in reducing stigma and everything that we do. We see that also leads to treatment, that also leads to people engaging in services because they're not being forced into abstaining. They're not being forced by an external agent saying to stop, or you're going to be, isolated and we're going to remove all services from you. We're simply trying to provide different resources that really will allow them to survive and be more informed and be empowered to be, to live to the best of their abilities. And in addition to those harm reduction resources, whenever they are ready, we really are super excited to then refer them to services and connect them with different resources, including housing, food assistance, employment opportunities, because we know that there's so many competing priorities. It's not only about substance use, it's also about food access, it's also about employment. If you don't live in a safe location, if you're being discriminated against on the streets, how are you going to be forced into abstaining? That's unrealistic, and that's, I think, a very narrow view. I definitely think kind of deviated from your question about innovation. But I think just very briefly in terms of innovation, I think one thing that we're really trying to build out is thankfully we were funded recently by the health department for an initiative regarding fentanyl test strip education and distribution. So we're currently building an online resource center where we're going to host 2 very quick videos, about 1 to 3 minutes long, training people on how to use fentanyl test strips to test their substances, as well as how to respond to an overdose using naloxone. And as soon as they watch those videos, they'll be able to enter their address. And if they live in New York City, we'll be able to mail those resources to them for free. So I think that's us really trying to meet people where they're at and, make it as accessible and as easy as possible.
Yeah, and that's what I would add to this whole conversation about how service delivery has changed with the pandemic. I think it's actually allowed us to make things a little bit more accessible. I think that before, when you consider things like regulation by like institutional regulation, there were some barriers for remote service delivery that with the pandemic, there was much better, like a higher understanding by institutions that remote service delivery can be beneficial. Or it was necessary, and so because of that, we were allowed to provide some of our services in a remote or hybrid manner, and this actually allowed us to provide some services to families it allowed us to provide services to families on a manner that was more convenient for them, and so that's how the conversation has changed with participants directly. So we are able to tell them, we want to make sure that whatever we're doing is the most convenient possible method of communication for you. If that is a Zoom call, we'll do it on Zoom. If you can do it from the privacy of your home, it helps them maintain their privacy and their confidentiality if they are wanting to participate in the services with us without anyone else knowing. And so that has definitely allowed us to engage the community in different ways, in being able to provide them with more options has increased the engagement that we get in our organization. Not because we are only offering one thing, but because we now get to offer them different things at different schedules. And that's definitely helped us.
Well, that's huge to me. I was the overdose prevention project coordinator in Portland, Maine, for public health in 2003. I had one of the first overdose prevention projects in the country, and we only dreamed of the things that are being done. I mean, our biggest thing was that they were allowing naloxone to be present with first responders, and that was it. Basically, we couldn't put it in the hands of people. We couldn't have it out anywhere else, even though we did have some trainings. Some of the organizations we worked with found a way, but still you couldn't. The police would accompany people on every single, first responders would be accompanied by the police on every single call. So many people wouldn't call. The Good Samaritan law didn't exist. There were so many things and this is really just a decade ago or a little bit more when I left there. I left there I left there 8 years ago, 2014. And it's just amazing to me. Like I hear you talk and it tears me up because we were fighting for this stuff. We couldn't, just wasn't happening. But I know that it's starting to happen in Maine a lot more now, but New York has really led the way. And it's really impressive to hear this. It's exciting. And as a person in long-term recovery, for me, it's even more personal because so much of the stigma attached to addiction and use of drugs has prevented people from getting these services.
Absolutely.
And it's I just think what you're doing is addressing those issues on so many levels. Now, when I was still in Maine, we were hearing about fentanyl. And I remember it was in Chicago. This was like 10, 11 years ago. And we were being warned it was coming to the Northeast. And once again, we weren't prepared for it. It happened because usually we're 3 to 5 years behind trends. I hate to say it, but funding is usually on a 3 to 5 year scheduling, and a lot of times we're still doing the work of the former funding when the new trends are hitting. So why do people need to know more about, what do you tell people about fentanyl? How can we have people gain access to this information? Just if you could comment on that.
Yeah, absolutely. Before jumping into that, I want to also thank you, Ronni, and saying that, all the work that you did in Portland and, and how you've really, again, enabled us to be doing the work that we're doing now. I really want to lift the importance of that work, how groundbreaking that was and how important it was to then have, these city, state, federal agencies, having that as part of their policies and practice, or at least what they have as allowable funding. And that's so important. With fentanyl, I do remember this, I think was probably around 6-ish years ago in college. I remember, I lived in a student cooperative with around 60 people, definitely people using drugs within that cooperative. And it was I think that was the first moment when I heard about harm reduction, when they said, this is how we can keep each other safe. And it was so groundbreaking to me. So it really was so amazing to hear people talk about substance use without talking about, if you use this substance, you will die. If you use this substance, you'll become an addict. If you use this substance, you will, destroy your future. Although, of course, I think have prevention plays such an important role, especially with youth, adolescents, and adults. If people choose to use substances, they have the autonomy to do so. What the important facet of prevention is at that moment is making sure they don't die, is making sure that they can reduce harm, especially with, people who inject drugs, equally making sure that they are not acquiring or transmitted infectious diseases such as HIV or hepatitis C. In terms of, to return to fentanyl, I think one approach that we'd like to take, and this was really, I think, uplifted, thankfully, by the Department of Health when we were communicating with them about our efforts to distribute fentanyl test strips even prior to the funding that we acquired, was that they were very intentional in making sure that fentanyl wasn't talked about in a stigmatizing way. So we don't like to speak about fentanyl as a dangerous drug. We like to speak about fentanyl as a potent drug, specifically because some people choose to use fentanyl. It's not that everyone who uses fentanyl is unaware. That's definitely a large part of it. Some people who use non-opioid drugs such as coke, crack, ecstasy through pressed pills, they may not be aware of fentanyl, and that's really the importance of fentanyl test strips, so then they can make an informed decision as to how they can reduce their risk, which includes, having naloxone handy, going slowly, using with friends, and taking turns. But additionally, some people do choose to use fentanyl, and that's for various different reasons. So we really like to approach our education through a stigma-reducing approach, where we talk about fentanyl as a substance that people either choose to use or may not be informed to use. If they do, if their substance does test positive for fentanyl, they may still choose to use it, even knowing that it has fentanyl. And there are different steps they can take, again, to reduce the risk of an overdose. And if their substance doesn't test positive for fentanyl, there are still steps people can take, because they're universal, safety steps that people can take. Again, going slowly, using with friends and taking turns, avoiding mixing drugs, and having naloxone at hand.
So let's talk about this innovation we mentioned earlier. And I got an email from Javier about doing a training via our podcast live on our video. So this is an opportunity for you to for both Javier, and I'm not sure if Javier and Yamir will do it together, but this is an opportunity to do this training. And for our listeners, this is for Javier and Yamir. Can you be as descriptive as possible for the listeners? Because this is going to be both. This is both audio and video. So we do have listeners. So because if they're listening, they want to get this access to get the test strips also. So I want to have the opportunity to share with everyone. So are you guys are you ready? All right, let's go.
Okay, great. So yeah, we like to do our training, and we like to start by letting people know, first and foremost, what fentanyl is. Fentanyl is a synthetic opiate, or more commonly known as a painkiller. It has been associated with the majority of the overdoses in New York City. And while it is most commonly found in heroin, it has also been found in other substances like powder, cocaine, crystal meth, ketamine, and pressed pills, including Xanax. So what we offer are fentanyl test strips that tell you whether or not a drug has fentanyl in it. Knowing if the substances that you are planning to use has fentanyl can lower the risk of an overdose, especially when the testing for fentanyl is used in combination with other harm reduction practices. So while these test strips are highly sensitive, and you can use very little substance to detect even the tiniest amount of fentanyl in the substances, what they will not tell you is what type of fentanyl is in there, or they will not tell you how much fentanyl there is. There are different types of fentanyls that have different potencies. So you don't really know that. All you get is a yes or no answer. So it is important to remember when using fentanyl test strips that not all substances that test positive will have the same potency, right? So if there are many different ways to test substances for fentanyl. The recommended way is that you grab all of the substances that you are about to use, you dilute them in water, and then you test them. However, we know that some people who use substances are concerned that would use too much of their substances and having to be diluted. So, you don't have to use all of your substances. You can use the residue that is left on the baggie that it comes with. Just put some water in the baggie, make sure that you're mixing that up, and you can use that to test for fentanyl, right? And so fentanyl test strips, I'm gonna hold it up, and they come in these little green packets. with some lettering on them, and they have some blue number here, number one in a blue box, and it says it's one strip. So each packet comes with one strip. However, as at a minimum, we provide people with 3 strips. Okay, and then on the back side of it, there are instructions, clear and very easy to read instructions about how to read the results of a fentanyl test strip. And there's also other information that is important to know, such as the expiration date. Okay, and so inside of that, you can find a fentanyl test strip, which I'm holding up. They are very, let me see, is that better? Yes. They're very small. They are kind of white and blue. What's important to know here is that there's a blue end of the strip, and there is another end of the strip that is white but has wavy blue lines. Okay, so if you want to test substances for fentanyl, what you do is you're gonna grab that little the little baggie that the substances came in, or maybe an empty cooker after someone has thrown out their shot. You want to fill that with water, and then you're gonna grab the white part with the wavy lines. You're gonna put that inside of the water for 15 seconds. You're gonna wait 15 seconds for it to absorb the water, and then you're gonna lay the strip on a flat surface for 2 minutes. After 2 minutes, then you get the results. And the results can be either positive, and that would show 1 line. For positive, it will show 2 lines for negative. And if it is positive, the recommended, if someone is seeking to use fentanyl, then they can use it. Or if they are not seeking to use fentanyl, the recommendation would be to be careful, right? And to use other harm reduction practices if they are going to choose to use it anyway. Now, again, this doesn't tell you how much fentanyl there is or what type, okay? We also like to remind people that the instructions on how to read the results are on the packet, because it is, people, when they look about it, they think a lot about pregnancy tests, and it's the opposite of that, right? It's not 2 lines means negative instead of positive. And so, again, realistically, when people may choose to use their substances, even if it tests positive for fentanyl. And additionally, even if the test result is negative, there is still the possibility that someone may overdose. So you can take other precautions to lower the risk of overdose, like make sure that if you are using substances, you're using with other people, you're not alone. It can be either someone else who is using and you take turns, or someone that you trust that can check on you. You want to make sure that you have naloxone available. We also offer training for that and are able to provide that to anyone in the community. Avoid mixing drugs, and you can also go slowly by taking small amounts. And all of these precautions can help save your lives. And that's our training.
Thank you, Javier. I also do want to very quickly note that as Javier stated, there's different ways to test it, which can include testing the entire substance by diluting it, though people may choose not to do so. So another way that people can do so, like Javier said, is by testing the residue, which can be in a bag or a cooker. One thing to note is that fentanyl does tend to bind to itself, and that's what some people call the chocolate chip cookie effect. So if you test a substance, there is a chance that even if it contains fentanyl, it might not have been part of the residue. So what is recommended is for you to crush, for example, a pill, or if it's a powder, to crush it very finely, to put it into a baggie, shake it to make sure residue gets all over, and then to empty it out and put it to the side. That way there's a higher chance that the substance that you are testing, if the fentanyl did lump together, that it's at least exposed and that it has a higher chance of being detected. Yeah, I think that's it for our training. I would love to ask either of you, maybe if y'all have any questions, or if you would like us to elaborate on anything else.
Chevar, I'm waiting for you to come up with these incredible questions.
No, I do
but-
have questions. I was trying to make do some behind the scenes work. I learned a few things, right? One, I didn't know there were different types of fentanyl. Like I just thought there was one. While you were talking, I was doing my research. So if you saw me look off to my phone, I was doing some research. And you said something interesting, like the term, like, can you elaborate on the chocolate chip cookie effect? That's that. I was like, wow. Okay, and how did that term come about?
Yeah, absolutely. So I think with the chocolate chip cookie effect, it's really trying to present a visual for what it would look like, for example, in a press pill. So if you think about a chocolate chip cookie, you'll have like the brown doughy cookie part, and then you'll have different spots of chocolate chips where the chocolate will be concentrated. Similarly, with a press pill, there might be the chance that the fentanyl binds with itself. So it'll kind of be clumps within the pill as opposed to being distributed throughout it. So that's why it's really important to make sure that if you're not dissolving the entire substance before testing it, that you really crush it very, very, very finely, and then try to shake it either in a baggie or a cooker before testing it to try to really increase the chance that you're detecting the fentanyl.
And this is an important part because you said that people can get these test strips if they participate in the training. We don't have an address. You got to give us the information for them to. Can you share that with us? Can you put that in the chat?
Absolutely. So I'll say that the easiest way to get these is through contacting us. So people can contact us at contact@saferhaven.org. That's one way that they could contact us through email. They could also go to our website, which is currently saferhaven.org. So SAFERHAVEN.org, and that way they'll be able to contact us directly. We're really trying to make it as easy as possible. So as soon as they contact us, we'll do the training and we'll ship it out to them. We don't want any delay. Additionally, we also do street outreach. So we're within the South Bronx community, knocking on doors, going to community events, on the sidewalks, trying to reach as many people as possible. And we're extremely happy to train people on the spot and to distribute not only fentanyl test strips, but naloxone as well. And also one thing that we're doing, which we really started with naloxone, is if we do a virtual training, we'll actually drop them off at your house. So similar with fentanyl test strips, if we're not necessarily mailing them to you, you can ask us to drop them off at your house. We're really focused on the Mott Haven community of the South Bronx right now, just because of the disproportionate impact of overdoses within that community. But we would be really happy to meet you wherever you're at, whether through mailing, pickup events, drop off. So they can contact us again at contact@saferhaven.org through our saferhaven.org website. Soon we will change the name to our website. However, we'll make sure to redirect it. So even if people search up saferhaven.org, they'll be routed to the NYC C4H website.
And we'll make sure that information gets shared in the description of the podcast. But Chevar, it's that time. It's already 30 minutes. And unfortunately, we have to kind of, move towards wrapping up our conversation, but it doesn't mean we won't revisit this with you. We'd like to do that. And also, as I'm sitting here thinking, we have a South Bronx Coalition called Forward South Bronx Coalition. And I think we should make a connection there because I think they'd be very interested in the work that you're doing. But, we talk about a lot of serious stuff on this podcast, but we like to end it with some fun stuff. So, Chevar, you want to ask our favorite question?
Absolutely. Javier, Yamir, think way back when you were much younger, when you were maybe a tween or younger. What did you want to be when you became an adult? Like, what was that aspirational thing? Like, for me, I wanted to be a NASCAR driver. I didn't realize I lived in the hood. There's no NASCARs. but that was something that I wanted to do as a child. What did you all wanted to be when you were younger? And tell us why.
So this is a funny question because my mom found one of my second grade assignments recently where they asked me that exact same question. I was 7 years old and I said that I wanted to be a math teacher, which is crazy because I'm terrible at math. So but that was my answer. And I think I was probably doing fine with my addition and multiplication back then. And so I thought I'm set, good to go. And so I decided to go with that. That obviously has changed since. And yeah, no desire to be a math teacher nowadays.
Math was great. Don't worry, I love math. And when I was 7 years old, that's when I wanted to be a NASCAR driver and a firefighter. Those are the two things at the age of 7. I have no clue because I'm not breaking into someone's building. Anyway,
Yeah, no, I do want to emphasize that math is amazing and it can be a lot of fun, but I'm just not good at it personally.
I absolutely love it. I don't think I would have ever thought to be a math teacher, so I love to hear that. I think for myself, if I think about potentially like middle school or high school, because I don't think I have too much recollection of what I wanted to be when I was in elementary school, I think I wanted to be a psychiatrist. I've always been drawn to the brain, and that's been a huge passion of mine. However, in college, I first came in as like molecular and cell bio, trying to study neurology, and then switched to cognitive science. But I really was, how do I say it, drawn back by how much of academia is kept like within the like walls of academia. And I saw like such a need to actually interact with my communities, whether they were migrant communities, Black and brown communities, queer and trans communities. And that's really what drew me to interacting with people, community building, community advocacy. So at one point in time it was psychiatry, but thankfully that is not necessarily thankfully, because again, love it, important, but not the current route that I'm on. I would love to ask Ronni actually, because I know that what Chevar mentioned, but I'd love to ask you if you could share even quickly what you wanted to be.
There were many things, but one of them, I wanted to be a rock star. I am a musician. I've been playing since I'm 7, playing guitar, and I've been in many bands, and I actually got to be a full-time musician. Maybe I wasn't a rock star, but I was a full-time musician for a chunk of my life. I still play music. Thank you, Chevar. And I still play my guitar and write, but I wanted to be a veterinarian, but I was terrible at science. And, one can't do that if they're terrible at science. And then when I went to college, I wanted to be a social worker, but that ended quickly because I had some teachers who just, I don't know, it made me lose my momentum. And I started to realize that I'm actually a writer, and because I've always been really good at that. And I wanted to be a writer for a long time. And I got my degree in English, but like many people in this field, and maybe one day I will write again. I do write. I mean, I never stopped, but definitely I wanted to write novels. I have written a lot of that stuff. It just sits on a computer, but that was where I was headed. But once I got into this field, the prevention field in 1989, I never looked back. I knew this was where my home was. It just got me. And I've been involved pretty much ever since, except for a 5-year break when I got into my own recovery journey, and I stopped for 5 years so I could get back on track. So that was a long answer.
Thank you so much for sharing that. Loved it. No, thank you.
But yeah, I keep an eye out. You may still see some of my work out there. I'm not giving up. I'm going to be 70 in June, but hey, a lot of people find themselves again at 70. So
absolutely. I will be on the lookout. Absolutely.
Okay, please make sure. And Google me, because you can catch a performance or two that I've done in the past out there. But unfortunately, we got to end our time with you, and we're so happy that you came, and I hope you'll come back. This is so exciting that we did a fentanyl strip training in our podcast. We a couple of podcasts ago, we had a Narcan training. So we like to know that we're informing people, and we will make sure your information's out there. Thank you so much, both of you, for being with us today. We will definitely distribute this, let people know there's some great information in here. And thank you both for the incredible work you're doing. You're making my dreams come true.
Thank you all so much. It's been an absolute pleasure.
Yeah. And Chevar and I are going to stick around, and we'll see you next time.
Thank you.
Take care. Okay, Chevar. That
was cool. Like I said, I learned something. The chocolate chip effect. I was like, what is that?
I know. Who would ever think that that's what it meant?
I was like, okay. You know, I've never seen a fentanyl strip. This is my first time seeing one.
Same
Seeing
here.
the packaging. I was like, okay, that's what it looks like. Okay, now I know. You know, learning that there's different types of fentanyl. When it was mentioned, I went straight to the internet. And I was like, wait a minute, didn't know that. Like, you know, that's something we don't talk about. Maybe that's a post
That's
for
true.
NYC Pop to talk about different types of fentanyl and the effects. I didn't know that.
I think we just like uncovered a whole bunch of new topics. We definitely want to make a connection with our Bronx coalitions. There's so much happening out there that people need to know about.
Absolutely.
You know, and hopefully we could spread some of that messaging.
Well, this is a great podcast. This is cool and very informative.
Very much so. And their passion is just, it just really touches my heart because I understand that. And so do you. You know, we like to think that the work we do changes a life, and they're affecting so many people. The dedication, just and the innovation. Just 10 years ago, the field didn't have all this stuff going on, and look where we are today.
Right.
You know, overdose prevention centers, recovery centers, things that just didn't even exist a decade ago. So very cool.
Very good stuff. Very good stuff. All right, that's about it, right? You know.
Definitely. We've had a lot of meetings today, but you know what? We're going to go on and do more.
We have another meeting. For those who are listening, we're going to be in another meeting soon in a few minutes.
But you know what? That tells you something. Prevention work never ends.
Never ends.
When I got into this field, I thought, I'm going to work myself out of a job. Well, as I mentioned earlier, I started in '89. There's more of a need for it today than ever.
Right.
So no matter what people are doing out there, you know, if you're in prevention, great. But if you're not in what's called prevention and you're working with young people or you're working with people, you're in prevention.
Absolutely.
Because there's many ways to offer people positive alternatives, to build people's lives up, to give them skills and tools and things they need in life. And that's what prevention's all about, helping people become who they are, who they were meant to be, and giving them a reason to want to live.
Well, to all the listeners out there, I hope you were paying attention during the training so you can get your test strips. Hope you learned as much as we learned. And we'll talk to you next time. As I say here,
We'll talk
to you next time.
Have a great one. Thanks for coming. Remember, we're the solution.
Nothing changes if we change nothing.
Have a good one.